Great.
Yeah.
Okay, so Roosevelt started recording. So first of all, we just want to thank you so much for taking time out of your busy schedule to speak
Sure.
with us. We're
Yeah.
really excited to have you as our first panelist on Diversity Talks.
Sure.
And Roosevelt's going to kick it off with our first question.
Sure.
Yes, Dr. Isaac. And also just a background, I'm a second, third year dental student at the University of Toronto, and also Liz is going into first year.
Okay.
So we're both dental students. So
Congratulations to you both.
thank you, thank you. So our first question is about your background. Where did you grow up and what is your story?
Yeah, so I grew up here in Toronto, North Scarborough. Went to various schools here and there. Eventually went to U of T, and biochemistry was my major there, my specialty, my specialist,
Mhm.
and uh, uh, just went right through school right here in Toronto. I'm Toronto born and raised.
Awesome.
Awesome,
Yeah.
good to know. So the
So
second question is this, yeah.
right. And did you always know you wanted to pursue dentistry, or you're thinking more of a science field?
Yeah, I always felt that sciences were for me. That would be the best fit for me. You should know my dad is a dentist, so that obviously had a big impact on me. I might not have told you, Lee. So, yeah, so that obviously had some kind of subconscious effect on me.
Yeah, definitely. My mother is a dental hygienist, so
Okay,
I feel the effect.
right.
And we'll have Roosevelt ask the next
Yeah, and
question.
we were wondering, did you experience any unique challenges on your way to become a dentist? Maybe because of the fact that you're a diverse individual, did you face any specific challenges that you feel like are unique to you and not maybe others?
Yeah, nothing overt, nothing obvious that I can really think of. Obviously, sometimes it can be a little subtle how people might treat you differently based on your background, but overall, nothing really overt or obvious that I can recall. So, knock on wood, in that regard, I didn't really have an obstacle. For me, it was mostly about hard work and dedication.
Hmm.
Great. And where did you pursue your dental studies?
Yes, so after biochemistry, U of T undergrad, I did my dental degree and my endodontic degree, certificate, I should say, at Temple University. So that's in Philadelphia,
Wow,
USA.
awesome.
Yeah, yeah.
So can you describe a typical day of yourself as an endodontist for us?
Sure. So I start either at 8:30 or 9. Lately, I've been doing 9 o'clock. And yeah, we come in, we get ready, we look at the schedule, figure out what we're going to do, have a little huddle, and then we see the first patient. A consultation could be about 15, 20 minutes. A treatment could be as long as 2 hours, depending on what it involves. So a typical day, it could be anywhere from 4 to 8 root canals a day. And of course, you throw in some consultations in between there. So overall, I think I had a record like 13, 14 patients last week, which is really busy for an endodontist.
Yeah.
For a GP, not so much, but yeah, that's my typical day. 4 or 5 treatments, 3 or 4 consults, and go and repeat.
Awesome.
Yeah, yeah.
um, so I had a question. I was wondering, do you ever have any patients come in with dental anxiety, and how do you manage that?
I do, and yeah, being an endodontist, that's going to be front of mind. People think about their nerves being taken out of their teeth, and they respond a certain way. I simply deal with them on a sort of a emotional, conversational level. Try to get them to understand that I'm not here to hurt them. I'm here to help them. I don't do any sedation in my office. That's just my choice. I just do nitrous is the most I do as far as sedation. I keep it very simple, and yeah, just make sure that the patient is comfortable, and we support them in any way we can.
Mhm. And did you know that endodontics is a specialty of yours from the beginning of dental school, or did you decide on it later on?
It was late. It was relatively late. I would say it was right around the time I applied, probably I guess in the mid fourth year. Again, with the influence of my dad, he suggested that maybe I look into a specialty. And then when I thought about doing a specialty, I said to myself, which one kind of makes more sense for me? I looked at perio, I looked at ortho, I looked at other options as well, oral surgery. I just felt that endo was the best fit for me.
Hmm.
Yeah.
Cool. And in terms of the work you do as an endodontist, could you tell us about the most challenging aspects?
Yeah, the most challenging, as far as procedures would be sort of the apical, the surgeries that we do on a mandible, like a first molar. I don't really do a whole lot of second mandibular molars. Those are definitely the biggest challenges. As far as running a practice, the day-to-day running and management, yeah, dealing with different personalities, the different team members that you have, managing personalities, dealing with how everybody is, and on a different day, people may be a different way, and you just have to sort of ride the roller coaster. Everybody has different things in life that they have to go through, and so management is also a big part of what I do. As dentists, we all wear many hats, and you guys will see once you are out there working in private practice that we wear many hats, and just being a dentist is just one of them. There's so many other things that go into it.
Yeah, like you said, it's really interesting how there's a business aspect intertwined
Right.
as well.
Absolutely. Absolutely. We're entrepreneurs as well. Yeah.
So we were wondering, how do you maintain a work-life balance? So what is your tips for maintaining a work-life balance, meaning like a
Yeah.
balanced lifestyle?
So yeah, it's one of those things that so I am married. I have two young children at home, and I want to make sure that I don't miss their childhood, and I want to be there. Obviously, dentistry is very demanding, and I do have to spend a lot of time in the office, but I want to make sure I spend quality time for them. So I've made the choice to sort of reduce the number of days that I work. I'll work a longer day, and sort of make it more efficient. But I do want to be home, and just have them to myself, while my wife, may do something else on her own. I take care of the kids, and it's a nice change. It's a nice break, and that sort of keeps me grounded. And then, of course, with COVID, this is obviously not as possible as it was, but just hanging out with my friends and doing normal things that everybody else does. Maintaining physical health, going to the gym, going for a bike ride, going to the beach, the normal stuff, vacations when possible. But obviously with the pandemic, things have changed.
For sure, yeah.
That's right. And that was actually our next question
Sure.
about your thoughts on how COVID-19 has impacted dentistry and your role.
Right. So specifically how it's affected the business of dentistry, I decided, again, it was with my family, my wife, we decided that, it was probably best for me to stay home, and I shut down the practice for pretty much 2 months. So that was tough. It was over 2 months, almost 2.5 months. And that was a very difficult decision to make, but we didn't know what we were dealing with, and we weren't sure what the college guidelines might be. And we'd rather be safe than sorry. So I shut down the practice, and I opened in mid-May, and knock on wood, business has ramped back up. No complaints there. You just have to deal with the PPE that everybody is dealing with these days, and that's a challenge. It is more energy expended when you are working with all that gear on, but overall, I can't complain. It has bounced back, and my understanding, my feeling from talking to different GPs around Scarborough and Toronto, that they're coming back as well slowly.
So do you have any advice for students who are like coming from diverse backgrounds and they're looking to pursue a career in dentistry?
Yeah, so for me, I never saw any obstacle based on my background, based on I'm born and raised here, but my parents come from abroad, and I never really, I'm just a Canadian guy, and I just, this is all I know, and I never saw an obstacle based on ethnicity or culture, anything like that. I always felt that I could be a dentist just like anybody else can. And I don't think it should ever be an obstacle for anybody based on gender, sexual orientation, all those things should never stop anybody from pursuing their dreams. And I just never saw it as something that would get in my way.
That's wonderful. Thank you so much.
Of course.
And I think that was our last question for you, and
Sure.
we ended on a great note.
Okay.
So if there's anything else you'd like to add, we'd be happy to hear from you.
Just anybody who may be looking at me as somebody who might inspire them to pursue what they want to do in dentistry, please don't hesitate to pursue your dreams and do what you need to do to be successful in life. Work hard. There's nothing like working hard, with the adequate effort, you'll get where you want to go.
Awesome. Thank you so much, Dr. Isaac.
Okay. You're welcome.
Thanks
You're
so
welcome.
much, Dr. Isaac.
Okay.
Have a great night.
Good day.
Bye-bye. You too.
Take care.
Yeah.